Good afternoon, class. This week I did case studies 11 on asbestos, and I also did case study number 16, which is on lung cancer. But for this exercise, I'm going to talk about asbestos. Okay, my patient is a 69-year-old male. His initials are RI, was referred to a pulmonary disease clinic by his nurse practitioner because he was recently been having difficulty catching his breath, and it's persistently gotten worse over time. His past medical history, he has osteoarthritis since he's been 30 years old. He had an appendectomy at the age of 13, was diagnosed with benign prostatic hyperplasia, resected about 7 years ago, and hypertension times 7 years. So he's got a number of things going on with him right now. He's also been diagnosed with hyperlipidemia for the last 4 years, and he's got the gastric reflux disease also for the last 4 years. This poor guy. His family history, both sides have cardiac issues. His father died at the age of 63, and his mother died at the age of 73. He does have a sibling, a brother who had died in a boating accident a few years ago. He's a social drinker. He is a smoker, times 1 pack per day for the last 45 years. Excuse me. He takes the following medications: acetaminophen, which is Tylenol for his osteoarthritis. He takes Rampapril, which is also Altace, for his hypertension. He takes Atenol, which is Tronamin, which is also for hypertension. He takes Provastin, which is for his hyperlipidemia, his cholesterol. And he also takes famotidine, which is Pepcid, for his gastric reflux. Denies any rashes, denies any nausea or vomiting, no diarrhea, no constipation, no headache, chest pain, dizziness, tendinitis, no bleeding episodes, denies loss of appetite or weight loss. His chief complaint, though, is generalized joint pain of his left knee, which also constitutes for his osteoarthritis. His vital signs at this time: he's got a blood pressure 131/75, respiration rate is 29, which is breaths per minute, which is rather fast. His pulse rate is 69. He had temperature was taken at 98.6. He's sitting 95% on room air. He's 5'9", and he weighs about 180 pounds. Skin is pink, warm, and dry. Lungs, he's got mild wheezing in the bases, but his heart's normal, and his abdomen is soft and non-tender. He's currently considered overweight. His BMI is 26.4 for his age, weight, and height. He should be within the normals of 18.5 to 24.9, and he's just a hair over that. Vital signs are normal, with the exception of his respiratory rate. That, as I stated, was considered fast because it's 29 breaths a minute, where the normal respirations are 12 to 18. Pulse ox is 95. That's low. We need to be put on some oxygen, probably nasal cannula. 2 to 4 liters will be suffice to bring him back up to the 98-99%. Has no major bleedings. He does have respiratory issues, as stated. He is hypercapnic because his PaCO2 is less than, or I should say is greater than 45, and he is considered acidic because his pH is 7.35. Anything 7.35 or lower is considered acidic. He's considered to be having restrictive respiratory distress or disease. And as I stated, I would be putting this gentleman on oxygen, 2 to 4 liters, nasal cannula. Simple fact that his O2 stat is 95%. May consider a non-rebreather if his respiratory rate doesn't slow down. For him, being in his intermittent stage of asbestos, I would put him on heparin to help treat it. It's also for chemo as well. So hope I covered everything. Have a good day.